So good day to everyone. Johnny Balmayo here, your clinical instructor for the health assessment skills, and today we're going to discuss about the body mechanics, just a continuation of what we discussed last week. Aside from the body mechanics, we're going to tackle also the positioning and also the Logrolling, and that is something that I'm going to demonstrate to you later. So first things first, in the Logrolling, what we need to do is we need to assess first. In assessment, I already told you guys, we need to assess for the client's physical abilities, the ability of the client to understand instruction, because I've told you, as I've told you last week, if the client understand and if the client is able to perform the procedure, pwedeng instruct na lang po natin siya. No need for us to do it for them, okay? Because napakarami ng client na i-deal with pa natin. What else? The degree of comfort or the discomfort when moving, and if needed, kailangan po natin mag-administer ng analgesics, especially to those client na nag-undergo ng procedures or they have something na masakit sa kanila. But always remember that whenever we give analgesics, it requires something, and that is what? The doctor's order. Okay, don't forget that. What else? The client's weight, because if the client is too heavy for us to lift or move, that's the perfect time na we will require something or somebody. Kakailangan na natin dito ng mechanical lift or any other instruments, or we can ask for our colleague na tulungan tayo. And then last, you have to assess also for your own strength and ability to move the client, because kung hindi mo talaga kaya, huwag kang pabibo, humingi ka ng tulong sa mga iba. Then next, we have to determine the assistive devices that we will require for this procedure. And by the way, this is our client. This is Kuya Jerry. We are here right now in the Nursing Arts Laboratory. What else? You also need to determine some encumbrances to movements such as an IV pole, as you can see in this, as you can see here, the IV pole. What else? Heavy cast, mga simento, those things, okay? Because those things may hinder the procedure that we're going to conduct. What else? Medications that the client is receiving, such as, what do you call this one? Anxiolytics, mga depressant drugs, okay? Yung mga client natin na nag-undergo ng procedures, there's possibility na meron pa rin niyang effect ng anesthesia. And also, assistance required from other healthcare personnel. Because as I've told you, kung di mo talaga kaya, huwag mo suluhin, you have to ask for somebody else to help you. Now, after the assessment, we will move on to the planning. So you have to assemble all the equipment and supplies that we're going to use. For this procedure, all we need are assistive devices such as pull or the turn sheet, o yung tinatawag din natin na lifter. This thing, as you can see here in this video, is the turn sheet or the lift sheet that we're going to use. What else? If ever, gagamit din tayo ng overhead trapeze and any other instruments. But for this procedure, i-demonstrate ko sa inyo, the only device that we're going to use is just the lifter or the turn sheet. Okay, sabi ko sa inyo last time, an instrument can change its name depending on how we use it. This one can become a top sheet, a turn sheet, or a lifter. It depends kung saan po natin siya gagamitin, okay? So after planning, we will now move on to implementations. Okay, in performing the procedure, or should I say the implementation, always remember the 4-word na sinabi ko sa inyo last time. These are the GIVE, G-I-V-E. G stands for greet your client. Si Mang Jerry ang pasyente natin, so you have to greet your client. Hi, good afternoon or good day to you, sir. I'm Johnny Balmayo from NUST, and for today, I will be your student nurse. Okay, you can use that phrase. So after G, next is I. I stands for introduce yourself. Okay. After that, V stands for verify your client. There are different ways in verifying your client. I already told you guys in the body mechanics. And E stands for explain. Explain to the client what you're going to do and how your client will participate or cooperate. Okay, so don't forget the 4 words. Give. Greet your client, introduce yourself, verify, and E, explain. Okay. After explaining to your client what you're going to do and why it is really necessary and how your client can participate or cooperate, you have to wash your hands and observe appropriate infection control. Okay, in the fundamentals of nursing, na-discuss na sa inyo ni Sir Morris. After washing your hands, provide for client privacy. Here in our nursing arts laboratory before, we have here the privacy curtain na ginagamit namin to separate the beds. But sa ngayon, hindi pa kasi na-install. Pero meron din tayong ginagamit na portable one. Okay? For the portable, yun yung hinihila lang. We can use that. Okay? To serve as a privacy, to serve for the privacy of our client. Okay, after that, we will now position ourselves and also our client. Just a little reminder lang, hindi natin masusunod yung nasa may manual ninyo because kung susundin natin yung nasa may manual ninyo, masyado tayong mahihirapan. So what I'm going to present to you or demonstrate to you guys sa araw na to is based on our experience. Okay? Tsaka mas pinadali po siya. So you might gonna ask me, sir, bakit hindi yun yung nilagay mo rin sa may checklist ninyo? Simple lang, kasi yung checklist natin, it needs reference. So, kinuha ko yung nasa may manual ninyo from the book ni Coshier and also ni Bates. But as I have said, dun tayo sa mas mapapadali yung trabaho natin dun sa my hospital. Okay, so what I'm going to demonstrate to you or what we are going to demonstrate to you today is based on our experience at saka I'm telling you mas magiging madali. Okay, so let's now start our log rolling. So what we're going to perform sa inyo ngayon, what we're going to demonstrate to you is the log rolling. At sa I have said, hindi natin masusunod ko yan sa may manual ninyo because mas maganda, mas madali, tsaka mas safe itong papakita namin sa inyo ngayon na log rolling. So first things first, safety first. Kung mag-isa mo lang, please lang observe proper body mechanics. Pero since ang pasyente natin medyo mabigat, I'm going to require help from other person. So ngayon, I have here Sir Kim with me. Siya ang tutulong sa akin. So, sige, let's now start. Kung mag-isa mo lang, be sure side rails up or side rails down. Since I'm going to perform in this side rails down dito, side rails down din doon. And since ang pasyente natin is naka-semi-founders, I'm going to put our client in flat on bed. Okay? Just a minute. Okay, done. So after putting our client in this position, supine or flat on bed, gagamit tayo dito ngayon ng lifter or turn sheet. Okay, in this procedure, Sir Kim and I will lift the client papunta dun sa may side niya. Nang sa ganun, mas madali yung paglalag roll po natin. Okay, so we're going to use this one, the lifter. Be sure lang guys na pagka gumamit kayo ng lifter, should be strong and you have a good grip on the lifter. Put the client's arm sa may chest niya. And then roll the lifter towards our client. Observe proper body mechanics. Isang paa mo forward, one foot at the back. Okay, don't forget that. Kung kaya mong ilapit yung sarili mo dun sa may pasyente or sa may bed, why not? Kung dun sa mas mapapadali yung trabaho mo. Okay, saan ako nakahawak? Sa may hips ni patient and then sa may shoulder, malapit doon. And then I'm going to ask my partner, Sir Kim, Sir, at the count of 3, i-move natin yung client papunta dyan sa may side mo. 1, 2, 3, go! Next, okay, we're now going to prepare our client for the log rolling. But before you do that, spread mo muna yung lifter natin or the turn sheet and then put a pillow dito sa may gitna ng lower extremities ni patient. You might gonna ask me, sir, what is the rationale behind that? This is for the easy log rolling and also prevent the dangling of foot for the lower extremities. Now, what I'm going to do is, I'm going to pull the client towards me and then Sir Kim here will push the client. Tignan nyo kung saan kami nakahawak ha. Si Sir Kim ay nakahawak sa may shoulder at nakahawak dun sa may thigh ni patient. While ako, nakahawak ako sa may hips and then dun sa may upper extremities niya. Again, at the count of 3, I'm going to pull the client and Sir Kim will push the client. Usually, 3 tao ang gumagawa rito. But since kulang kami ngayon, pwede rin itong gawin ng 2 tao lang. Isa, 2, and the other person, nasa may taas, nakasupport po dun sa may ulo ni patient. Okay, so sige. At the count of 3, sir. 1, 2, 3, go. And then, take another pillow. This pillow will be used to lock, or should I say, to anchor the body of the client. Nang sa ganun, okay, hindi magsusupine si patient, mapiprevent natin ang pagsupay niya, and also at the same time, hindi masyadong mag-move papunta rito si patient. Thank you, Sir Kim. That's it. That's how we perform log rolling of our client. I'm going to present also some other videos sa inyo guys para mas makita ninyo the different ways in performing this procedure. Okay, after this, get another pillow. Pwede natin i-support dito sa may front knee patient. Nang sa ganun, mas ma-prevent pa natin yung pagpropronation ni patient. Before leaving our client, be sure lang to re-evaluate the surroundings such as the lifter, maayos ba? Okay, what else? Gawin dito. Itap natin papunta doon, or should I say sa ilalim ng bed. And then, last is the side rails. Side rails up tayo. Okay, ganun din sa may kabila. And if we have a signal cord, better to place it beside kay client. So that's it. We will now move on to evaluation and documentation. So okay, after the implementation, we will now move on to the evaluation and documentation. But before that, just a little information to you guys. Kung papansin niyo dun sa may manual natin, they actually use the turn sheet or the lifter, okay, to turn the client. Hinila from here, ihilahin papunta rito na sa ganun yung client magla-log roll. Kaso, the problem with that kasi is the safety of the client, and also masyadong mahirap yung ganung procedure. So let's choose the best log rolling and also the safest. Yung pinakita po namin sa inyo ni Sir Kim. Okay, what else? Sa may first procedure din ng manual natin, they actually put their hands ng mga nurses, kung mababasa ninyo, okay, sa may ilalim ng client. And then they actually pull the client. So the reason kung bakit hindi ko pinagawa sa inyo yun is that if the client is bedridden or an old person, piniprevent natin dito yung what do you call this one? Friction. And always remember na kapag may friction, it causes heat, and if nagkaroon ng heat ang skin, lalo kung matanda yan or bedridden, there's a huge possibility that the client may develop what do you call this one? The bed sores or the decubitus ulcer. So, kaya hindi yun ang pinakita ko sa inyo na procedure. Okay, so ang gagawin niyo in your return demonstration is what we demonstrated to you. Okay, so after the implementation, we'll now move on to the evaluation, documentation. All you have to do is record the time and then the change of the position and move from and move to. Okay, also you have to reassess and reevaluate your client for any signs of the pressure areas or the decubitus ulcer or the bed sores. Ano pa? Did we use any support devices? So far, ang ginamit po natin na pillow dito is, ginamit nating device are just 2 pillows. Dito sa may lower extremity and then at the back ni Mang Jerry. What else? The ability of the client to assist in moving and also turning. Kapag ang client natin is nakapag-respond na, tsaka may kakayahan na rin siya to ambulate or to do it by himself, i-chart din natin yun, i-document natin yun. Meaning to say, there's really a development na nangyayari dun sa may client natin. What else, or should I say last? Response of the client to moving and turning. Meaning to say, ano ba naging response ng client natin dun sa may ginawa nating position? Meron bang sumakit? Meron bang naging, what do you call this one? Problem during the turning and repositioning? Okay, those things are what we need to document. Okay, so that's it guys. That is the log rolling. That is something that you have to perform and to be submitted in our Schoology account. Okay, that ends our discussion for the log rolling. Next one will be repositioning. So this next procedure is applicable, or should I say appropriate to use, sa mga client natin na merong problema or we suspected that they have a problem with their spine. Kapag ganito ang case natin, ito ang pinakamainam na gawin. So, this case came from emergency room and this is the setup. So, let's start. So, as you can see, there are actually 3 healthcare provider here. So, we have here, this person is holding the head. Siya magsusupport if ever na magkaroon na ng log rolling or they perform the log rolling. Then these two person will turn the client. Just a little information. Kung sino yun dun sa may ulunan, siya ang magbibilang. Kumbaga siya yung pinaka-chief noong procedure na gagawin ninyo. And as you can see here, meron tayo rito, the flat board. Yung flat board niya yun yung ginamit para may transfer si patient papunta doon sa may bed. And then, to support the patient, they use here a wedge. Okay, if ever na hindi available ang wedge, we can use pillow. And then, if ever na wala ang pillow, we can use a funnel or a towel or a folded na, what do you call this one? A top sheet or a linen, should I say? So, ang pinaka-leader in this procedure, or should I say, yung nag-supervise sa mga healthcare provider is this person, yung nasa may ulunan. Next procedure, they will flatten the top sheet or the flannel. Kaya nang sa ganun, walang mga wrinkles. Next, once everything has been settled, okay na, walang mga wrinkles dun sa may bedsheet natin. First is, you also have to evaluate the alignment. Naka-straight position pa rin ba? Yes. So, that's it guys.